Hello, everyone. Welcome to today's Knowledge Mobilization workshop, Doing More with What You Know, an introduction to knowledge mobilization for newcomer-serving professionals. It's so nice to see that we have so many who have joined us, and we look forward to welcoming more as they come in. So we'll just get started. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. CHIO also honors all First Nations, Inuit, and Métis peoples, and their valuable past and present contributions to this land. My name is Colleen Drake. I am N4's Project Engagement Coordinator. I will be hosting and moderating today's presentation with my colleague and co-host Andrew Tomeyer, N4's Education Coordinator. I am now pleased to welcome our workshop presenters and facilitators. Welcome, everyone. I have Sarah Pinder, who is a knowledge broker at the Knowledge Institute for Child and Youth Mental Health and Addictions. She has a background in community mental health research and arts-based education. Nikki Summers is the manager of knowledge mobilization at the Knowledge Institute on Child and Youth Mental Health and Addictions. Nikki has long brought her passion for evaluation, engagement, and knowledge mobilization to her work in roles in both research and community engagement. Amy Porath is the Director of Research and mobilization at the Knowledge Institute on Child and Youth Mental Health and Addictions. Amy holds a PhD in psychology and is an alumna of both the University of Ottawa and Carleton. We also have members of our N4 team who will be supporting us as facilitators today. Christine Curry is N4's director and has over 30 years of experience in the Canadian healthcare system and is known for her initiatives and expertise in equitable healthcare across sociocultural, diverse, and marginalized populations. Upon obtaining her master's in health administration, she was recruited to CHIO to lead the development of their patient experience department. As the manager for that department, she led CHIO's efforts to ensure an optimal experience for Syrian refugees that were welcomed to Ottawa in early 2016. Michelle Quinlan is N4's team lead on knowledge mobilization, a specialist in project management. Michelle came to CHIO in 2017 after 15 years of public service with the City of Ottawa. Drawing on her lived experience, she is passionate about the patient voice in the healthcare system. Michelle was the lead for patient engagement in research at CHIO and worked at CHIO Development and Rehab. Michelle was part of the N4 team in 2021-2022 during the development of the National Community of Practice and recently returned to N4's team as the team lead knowledge mobilization. Catherine Penny is the Quality Improvement Specialist for N4. She is an experienced policy analyst and researcher, driven to improve social equity through policy. She takes great pride in providing an intersectional approach to stakeholder engagement. She has worked in federal ministries where she has advanced policies to improve equity for vulnerable populations. Welcome to you all. Thank you so much. I just have a few housekeeping slides. We do ask that you keep yourself on mute, unless, of course, you're in the breakout rooms or you're asking a question. Please use the raise hand symbol or make a comment in the chat to notify us if you have a question. We also encourage you to turn on your video today if you're comfortable doing so. However, this is optional. Today's presentation recording will be happening in the didactic portion and will recap parts of the workshop. The breakout group discussion will not be recorded. The recording will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we will inform you with details for an alternate makeup session. Today's event will begin with a short didactic from Sarah Pinder. We will then use the breakout room feature and randomly split the group into 4 breakout rooms. For approximately 40 minutes, each group will have the case study and engage in a discussion led by our facilitators. One person from each group will be invited to report back to the whole group after the breakout rooms end, and there will be an opportunity for future questions and comments. Sarah will conclude and some take-home messages. I will now hand the virtual mic over to Sarah to take it away. Thank you so much.
Thanks so much, Colleen. I'm just going to get my slides set up here. Well, thanks so much for joining us today for our webinar on knowledge mobilization and putting evidence into practice. My name is Sarah Pinder, and as Colleen mentioned, I'm a knowledge broker with the Knowledge Institute on Child and Youth Mental Health and Addictions. I'll be facilitating today's presentation. Here's what we've got on our agenda for today. Starting now with some welcome and opening remarks, and I'm going to walk you through our recently refreshed knowledge mobilization toolkit called Doing More with What You Know. We're going to break out into some small groups for a case study activity together, come back together for a report back and some take-home messages, and wrap up with some closing remarks. Before we dive into the content in our webinar, I'd like to briefly introduce the Knowledge Institute and our knowledge mobilization work for those who might not be familiar with us. Knowledge Institute is a provincial program based at the Children's Hospital of Eastern Ontario, and for the past 19 years, we've been focused on mobilizing knowledge and improving quality across Ontario's child and youth mental health and addiction system to support positive outcomes for children, young people, and families. We do this by sharing evidence, building capacity, and creating connections to close the knowledge to practice gap. Our work at the Knowledge Institute spans the early years through to the transition years. We target our efforts in 6 focus areas, including complex needs and intensive services, integrated care pathways, equity, diversity, and inclusion, youth and family engagement, substance use and addictions, and virtual care. Knowledge mobilization in the child and youth mental health and addiction sector is one of the main focuses of our work here at the Knowledge Institute. We focus on policy, research, and practice. I hope today's session will give you some fresh perspectives and insights on knowledge mobilization and resources that you can take away to support your own efforts. We're going to start by exploring the Knowledge Institute's refreshed knowledge mobilization toolkit, Doing More with What You Know. We've developed this toolkit for anyone working on knowledge mobilization projects, especially for those who are in the initial planning stages of this work and those working in the child and youth mental health and addiction sector. In this presentation, I'm going to talk about what's included in our updated toolkit, why we might mobilize knowledge, what we include under the umbrella of the term knowledge, how to plan, conduct, and evaluate a knowledge mobilization project. And at the end of this webinar, we'll show you where to access the Knowledge Institute's Resource Hub and download the free toolkit on our website in English and French, as well as other resources. Our updated toolkit includes a step-by-step guide to knowledge mobilization practices, tips and tricks you can use in your knowledge mobilization work, links to additional resources to further build your knowledge, and examples of knowledge mobilization work happening in the child and youth mental health and addiction sector. We've updated our toolkit to give those doing KMB current and comprehensive information to support you in developing and sharing high-quality, impactful resources today and in the future. What do we say when we say knowledge mobilization? What do we really mean? Activities that make evidence accessible, clear, and useful for the knowledge users who need it, including things like knowledge synthesis, dissemination, transfer, and exchange. Knowledge mobilization, sometimes referred to as KMB, and knowledge translation, sometimes called KT, are frequently used interchangeably. Knowledge mobilization is generally used when referring to social sciences and humanities research, and knowledge translation is often used in medicine and in the sciences. In the child and youth mental health and addiction sector, knowledge mobilization speaks to the use of evidence and expertise to align research, policy, and practice to improve outcomes for children, young people, and families. For example, let's say an agency that provides service for children has program evaluation data, and they want to share those findings in an interesting, useful, and accessible way with staff and clients who've been involved in the evaluation process. Knowledge mobilization can help them to do this. So what kind of information are we referring to when we use the word knowledge? Knowledge can be scholarly. It can also come from on-the-ground practices of those working in a particular field. It can also include traditional knowledge from Indigenous elders and knowledge keepers, and includes people's lived experiences. In our work in the child and youth mental health and addiction sector, we focus on the experiences of children, young people, and families. And why do we prioritize mobilizing knowledge? Knowledge mobilization draws attention to issues that matter and enables people to strategically use information to create change and make improvements in the world around us. The practice of knowledge mobilization is not simply about publishing the latest evidence for end users. It uses meaningful engagement to make sure information has impact. Increasing the accessibility of knowledge increases the likelihood that it will be used. Knowledge that has been mobilized through things like knowledge products, events, and networks can help people address problems in their lives and communities, mobilize for change, raise awareness, and provide meaningful evidence to collaborators that initiatives are impactful. At its core, knowledge mobilization is about people and relationships. It's about communicating valuable information with the right people at the right time to help ensure meaningful engagement and impact. Knowledge mobilization is not just about putting information out for consumption. It requires developing resources in partnership with the key audience for those resources, recognizing that audience as an equal stakeholder in project development. It's important to engage your audience during the planning stages to design and deliver information and tools in a way that makes most sense to them and ensures they're involved at the level they want to be in all stages of a project's development. Planning a successful knowledge mobilization project requires you to consider a number of factors before you start. Like, who will be involved in sharing the knowledge? Are there credible partners or community champions who can join you in this work? How do you want to use this knowledge? What knowledge do you want to mobilize? What are the key messages that you want to uplift? Why do you want to mobilize this knowledge? Why are these messages important to your audience? Do you want to engage, inspire, motivate, or educate your audience? And when do you want to mobilize this knowledge? Are there other things happening at this time, either in your organization or in the world, that might affect uptake? How are you delivering your message to your audience? How are you going to engage with them when developing these KMB materials? And finally, considering measurement. How will you know when you've achieved your goals? What indicators will you use to measure your efforts? Now that you've considered the details required to make a solid plan, how will you put that KMB plan into action? There are three main types of resources commonly produced in knowledge mobilization work. Engage with your partners and key audiences to decide on which type of resource will work best. You could develop knowledge products, which includes things like reports, fact sheets, infographics, and toolkits. Events, like conferences, webinars, forums, debates, workshops, and TV or radio interviews. And networks, which refers to frameworks that connect people together, often virtually, like communities of practice, online forums, social media, listservs, and message boards. No individual strategy is going to work in every situation, and you might need to choose several different strategies to target different audiences. Taking the time to focus on making your story accessible to a wide audience and sharing information in a compelling way can mean the knowledge you're sharing has greater uptake. Use clear language to convey your message by writing in the active voice, using a familiar and welcoming tone, avoiding jargon and defining technical terms in easy to understand ways, and using lists to make information quick to access. Using clear language removes barriers between you and your readers, making it easier for everyone to understand and use information. Beginning with a solid understanding of who you're wanting to speak to, what your communication goals are, and the main message you're trying to get across can help your projects to stay focused and make it clear what the essential components of your story are. You can also use storytelling. Most media we consume today, from news to entertainment, relies on narrative storytelling to get and keep our attention. Stories are so good at keeping our attention because humans are social. We want to relate to others. Showing your voice and personality in how you convey your message and speaking from the heart can help you connect with your audience. Stories that are truthful are more powerful. McCall and colleagues note in their 2021 paper on storytelling in public health that storytelling also has a unique ability to change behavior because it allows for more, quote, nuanced, contextualized, and culturally reflective information to be shared. Change can happen when members of the public can clearly see how knowledge is directly relevant to them in their cultural context. You've now made your knowledge product, event, or network. How do you know if what you've shared is getting into the hands of the right people, and if that information is being used? Using evaluation to explore the process, outcome, and impact of your project can help you to answer these questions. We know that evaluating outcomes and impacts are important, but don't forget to think about your process too. Evaluating how you did the work will give you crucial information about the success of your project. It can also help you to improve your methods for future projects or partnerships. What can be carried forward and what might need to be refined or set aside next time? Consider using mixed methods in your evaluation. Drawing on both qualitative and quantitative data can give you a more holistic picture of your project. You might run into challenges in your KMB work. Evaluating your work at every stage can help you identify those challenges as you go and work to address them in real time. What are some barriers you experience in doing knowledge mobilization work in your agencies? I'm going to share some examples on the next slide, but feel free to share some here in the chat, and we'll return to those in our discussion. Barriers to doing knowledge mobilization work can include things like resource limitations, lack of training for staff, missing infrastructure at your agency to support KMB work, a lack of attention to differing capacities of partner organizations, and challenges measuring impact. I'll just note here that our toolkit also includes discussion of navigating challenges and ways to overcome them. I'm conscious now because I'm in presentation mode, I can't quickly see the chat. I wonder if one of the N4 team wants to take a look and see if there's some comments in the chat from folks with challenges they're experiencing and would like to sort of relay them to the group.
Of course, Sarah. I don't see anything popping up just yet, but
Okay.
I'm sure we'll have some soon. So I'll
perfect.
let you
We are
know.
going to be breaking it into discussion rooms soon. So there's an opportunity for folks to work in small groups to chat a little bit further. No problem. Thank you. We're now going to be considering how you can make an impact through using KMB in your own work. When starting to plan a knowledge mobilization project, here's some guiding questions you might want to consider as you get started. What drives the need for KMB in your work? What KMB activities are you already doing at your agency? Who are you reaching well, and who are you trying to reach? What messages are impactful for your audience or audiences? What strategies will work best and meet the needs of your audiences? And how might you collect this information? We're going to walk through a case study activity together using data from an N4 paper to think through what making decisions about how to mobilize knowledge can look like. So the issue in our case study that we'd like to think through today is access to interpretation. So a lack of centralized professional interpretation services creates administrative inefficiencies and increases patient risks. We know from the 2021 census that 69.4% of recent immigrants don't speak English or French as a mother tongue. Time and money are wasted when people experience barriers to communicating with their healthcare providers or accessing appropriate services. We see there's a need for better access to provincial interpretation services. A lack of access to these services has meaningful impacts on both clients and service providers. They include things like decreased access to care, increased family burden for those taking on an interpreter role, lower satisfaction with care, lack of engagement in the care plan, increased risk of medical errors or complications, repeat visits, administrative burden, staff frustration, or litigation and reputational risk. To respond to this issue, we've got a main message we want to mobilize. There's a need for pan-Canadian standards where healthcare interpretation is centrally organized and funded by the province's Ministry of Health. Here's some ways you might decide to mobilize this. Tabling this message at your Standing Committee on Health with N4's support. Sharing this information with those invested in healthcare equity. Connecting with N4 to learn how your province can benefit from a centrally funded interpretation service. What other ways would you go about mobilizing? We're going to break into some discussion groups in a moment, as I mentioned, to talk about what strategies you would use and how. I'll also say too, for those who might be panicking about the fact that I've just sort of presented a bunch of information, we'll have facilitators in each of the breakout rooms who will help to lead the way, and we have a facilitation guide that includes all of the stuff that we covered on these slides as well. So you'll be heading into each room with that info. Again, as we head into our breakout groups to think about mobilizing knowledge, here's some points to consider. Research literature highlights that the target audience for a message must be clearly identified, and the specifics of a knowledge transfer strategy for that audience be fine-tuned to the types of decisions they face and the types of decision-making environments they live or work in. We can ask ourselves, are we engaging with the right people? Who can act on the basis of the available knowledge? Who can influence those who can act? Which target audiences can we expect to have the most success with? Do our KMB activities fit the needs and interests of our key partners? Is it useful for people? Are we engaging with partners, stakeholders, and community members at the right level? And is our KMB effective? Are we seeing an impact? Let's take some time now in breakout groups to discuss this sample case study further. And then we'll come back after for a report back.
Thank you so much, Sarah, for getting us started. It looks like we're going to have some great discussion. So if you'll bear with me for one moment, I'll just pop up the slide and we'll have everyone on their way into the breakout rooms momentarily. So we've decided with our group of 20 individuals, we will pop you into 3 groups, and our facilitators will be Nikki, Amy, and Christine, and the N4 team members, Michelle and Catherine, will be put into one of those groups to support. You'll see Sarah popping into the groups to join you for discussion. If we whisk her away, apologies in advance. It's just so that we can share Sarah with the other groups that will be in discussion. So we'd now like to engage you in the facilitated discussion about our discussion today. We'll be putting you in those breakout rooms. We are going to Oh, thanks, Andrew. So we ended up with our 3 groups. Group 1 was facilitated by Amy with support from Catherine. Group 2 was Christine Curry, and Group 3 was Nikki and supported by our N4 team member, Michelle. So what we'll do is we'll just ask each group to go in order and share any information that you'd like to share with the larger group. And we've set aside, I believe it's about 40 minutes or so for the report back. And we'll start with group 1. So over to you, Amy.
Okay, thanks so much, Colleen. We had a really great discussion about just some ideas for how we could inform a knowledge mobilization plan, but we also talked about some of the challenges and barriers, as well as facilitators to moving ahead with the work. So I'm going to just go through some of the highlights, and I invite members of the breakout group to complement or supplement anything that I may have missed. So we talked a lot about how it's really, it would be great to involve the stories of people with lived experience. So those who have had experience without health interpretation services, because it can be a really powerful way. to help convey the importance of this issue. So we think that that is really an important group that we would want to engage with. We also talked about the importance of engaging those service providers who are working on the front line with clients, and really, get a good understanding of sort of what are their needs and what are some of the challenges that they're dealing with. But also the client, understanding the client perspective. So the clients who are coming in for healthcare, what are some of their challenges, some of their needs, and really understanding that from both perspectives to help inform a strategy for mobilizing knowledge. When we're talking about the how, so how do we want to mobilize? We talked about the importance of creating buy-in with provincial territorial governments, and how it's important to present lots of facts and figures to really create that business case with the decision makers on the need for the Pan-Canadian standard. And then we talked about how this again comes back to really knowing your audience and understanding them well to really form a compelling knowledge mobilization plan. And Catherine talked a bit about N4's efforts to developing a template letter for individuals to share with politicians. We also talked about how it would be great to create some basic tools for community partners or organizations to engage them in the advocacy work, to inform the minister or their local members of parliament. But we acknowledge that this can sometimes be challenging because not everyone is engaged in the political process, may not understand sort of what the process is, who needs to be engaged. So again, we also talked about just having a bit of education on that so that, individuals who would like to help with that advocacy work can have that understanding and have that capacity building. And again, we talked about the importance of bringing in people with lived experience to tell their stories as part of that work. In terms of the when, so Heather strategic, we talked about, is there strategic dates or strategic meetings that we would want to leverage to try and mobilize this, the key messages from the position paper. And Catherine mentioned the recent FPT Health Ministers Summit in PEI as a really great example where you have all of the ministers of health from all the provincial, territorial, and the federal governments coming together talking about health priorities. So what a great way to catch all of them and talk about the importance of this work. We also talked about thinking about, considerations to make it easy for different partners to participate in the process. So we talked about, communities, getting community members involved in some of this work, but being mindful of, organizing sessions in evenings or weekends when more community members can participate, and thinking about things like childcare or transportation. So really trying to think about potential barriers for people participating and trying to mitigate against those barriers. We talked about also another sort of way of mobilizing the knowledge through different presentations to settlement workers, people working in allied health sectors. And then we just started talking about the measurement piece and how do we know if we've been successful. And Catherine shared the work N4 is doing on their provincial scorecard, and really it's sort of a bit of a status check with the provinces, but also acknowledging that sometimes it can be challenging because nobody wants to be graded publicly. So we had a bit of a discussion about that. And then, one of the key indicators of whether we've been successful, of course, has the standard been adopted? So has there been buy-in? Has there been uptake and implementation of, agreement to develop this new Pan-Canadian standard? And then finally, again, we came back to the idea of storytelling and really sharing the stories of people with lived experience, and talked about, has there a way we could document sort of the journey of newcomers coming to Canada, about their experience and their journey, and just as a way of sharing. So I'm going to look to my fellow breakout room colleagues, was there anything that I missed that we want to share? I'm seeing a hand, so I don't know, is that a clap, Marion, or did you raise
It's
your
clapping.
hand? Awesome.
You did a good job.
Nice.
Thank you.
Thank you
Thanks so
so
much
much.
for reporting back, Amy.
No problem. So I'm going to turn it back to Colleen, and who's in the hot seat next?
Exactly. Well, thank you so much, Amy and Catherine, and all of Group One for bringing that forward and sharing, you know, the challenges and those creative solutions that you came up with. So fantastic. Sarah, was there anything that you wanted to add from your small time that you popped into the group?
Yeah, not zooming in and out around all the rooms. No, this was great. That was a great synopsis, Amy. Thank you so much. Yeah, the wanting to fold in and highlight and uplift people's lived experience all throughout this work just feels like such a vital point for me, which I mentioned to folks in the room as well. So
Fantastic. Thank you. So we'll move on to Group Two, facilitated by Christine Curry. Thank you.
Yes, hi, and I got nominated to report back for my group. So we had a nice group in that we really had varied perspectives from acute care, from the community, a settlement agency, to somebody with lived experience that's doing urban planning. So that was really neat. So a wide variety, a lot of the same messages that Amy said in terms of the stakeholders, right? The hospitals, we had a different, maybe one additional one was that we have a lot of internationally educated health professionals. That would be a stakeholder, and they needing to be aware when you come to Canada, like interpretation is important, and expectations and so forth. Talked about, you know, communities as a way to the lived experience, talking about the community centers tend to be more involved in healthcare because hopefully people stay healthy. So we definitely don't see all of the newcomers. So that would be a great way. And of course, also identify the provincial ministries of health as a stakeholder, and the federal minister of health, given they have the purse strings. Let's see. So we talked about getting those community partners to amplify our message. Maybe an open letter could be shared that they could add on to. One of the challenges that we definitely talked about is there's a lot of talk, as there should be, about the healthcare human resource crisis. So that's, you know, you see that in all the headlines, and we're kind of the, yeah, but, you know, so Sarah was helpful in pointing out, like, how can you think about leveraging that and adding to that? We talked about, okay, well, IHPs are coming in to help solve that, but then again, they're bringing their families who, you know, may not speak the languages, and they'll be future people, and helping the cause in IHPs by saying, and maybe they could help us with this, because then you could have a provider actually speaks different languages as well. We talked about another stakeholder that came later was places of worship, knowing that they've taken an increased role with newcomers, most recently with, you know, sponsoring refugee families or providing aid. There's a lot of, you know, housing shortages. They are seeking, asylum seekers are using their basements right now, especially in Toronto. So those places of worship have not been on our radar. So I appreciated that being brought through. Let's see, we talked about social media, saying, you know, does that work? Do people see it work? And we definitely said yes, that people are attuned to that despite some of the downsides, and, you know, Facebook, LinkedIn. And then that even webinars where you're not the prime audience are an opportunity to network. Even when we have all these virtual events, there is that sharing of resources. So not to forget, that's another route to promote what N4 is doing. Let's see. I think that was it, unless somebody from my group has something to add.
Not seeing any hands.
I was just, if no one else from the group wants to jump in with additional points, I think the thing that I took away from this conversation was just thinking through doing this work collaboratively with partners can mean that maybe you start out deciding that one message is the message or the thing that you want to do. And then with further conversation with your partners, you realize maybe the message actually needs to be a different message, right? Or like you need to change the angle that you're approaching things with, or maybe there's something broader that could sort of encompass all of your perspectives simultaneously. Like I think, I don't know, I wanted to just kind of be like, it's okay to change direction, right? It's okay to shift gears. It's okay to sort of adapt and juggle in conversation with your partners to sort of try to pivot to find the most effective direction to go in, right? Like I feel like that's very much part of the process, and wanting to just sort of normalize that as like part of this work, right? Like just needing to try to be agile, right? Or flexible.
Wonderful. Thank you so much, Christine, and the members of Group 2 for providing those interesting details and information on the work, and to Sarah for her comments. I will now pass it over to Nikki Summers, the facilitator of Group 3, supported by Michelle Quinlan, I believe. So over to you, Nikki. Thanks.
Thank you. And thank you so far. The summers have been so thorough and have generated a lot of ideas that maybe weren't shared in our group or overlapped or aligned really, really nicely. So when I joined my group, I was pleasantly surprised to hear that I have a few members that were very, very involved with the development of this paper and the launch and mobilization of this paper. So we pivoted a little bit with how we ran our discussion and really got to hear about what efforts have been made to date, the successes to date, how that's the term pivoting is also a great word to add in, and how they as a team have really started to pivot and meet the needs of their different audiences to reach those various levels, from like federal national standards to provincial needs to organizational needs around policies for translation. So a lot of lessons learned, but we also came together around our challenges and measurement and impact. So really struggling with Sarah's sentiment around this is all about relationships and partnerships, and how do you measure that when it comes down to it? If a lot of our work is really about building, leveraging, and growing relationships across our sectors or larger, how do we demonstrate that when we go to evaluate our impact? And I don't know that we came up with a lot of answers, but I think there's a lot of camaraderie around, yeah, this is a struggle and this is something that we're all challenged by, but are looking at creative ways to solve it. Another thing that Michelle talked about was their approach to developing their K&B plan for these papers that I think was like a light bulb for me when they talked about really starting to map out their key partners from a wish list rather than a quick wins. And we often approach it as a quick wins. Like, we know these people, this would be the best way to get it out to these groups. We already have these advisories or these COPs established, and absolutely, let's do it this way. But they kind of flipped the script and gone, this is where we really actually want to get it. What are some creative solutions to do so? So that was really cool and something I wanted to take back to my team. And I see Sarah nodding, going, yeah, like this is a different perspective. And I really liked hearing about that. But I don't want to take up too much airspace because we had some really, really good discussions. So I'd open it up to my other group members if they wanted to jump in to share some of their key nuggets.
Sure, I'll start, and Kat, feel free to join if you'd like. I think I'm listening to and I'm writing notes, obviously, with what I'm hearing from the other groups. A lot of the same pieces came out. In terms of the who, quite obviously, provincial governments is the main audience, and provincial bodies, ministries, etc. With that intent for policy change and policy recommendations. And I've learned other ideas in terms of the who from the other groups. The how piece, we really talked about how we wanted to, that there's opportunities to take the paper and make it into digestible pieces of information, facts, figures, etc. What Sarah is saying with this change of direction. There was a piece that the team was able to do in terms of creating a 2-pager document with those core outcomes, and also a sort of change in direction piece as well, with creating a letter that could easily be shared for advocacy, right? started, brainstorming. We started brainstorming about, with the IEHP work that N4 is doing right now. There's additional position papers that have been written, and a huge success, I think, in terms of knowledge translation is the development of a video of the webinar that sort of highlights, what the paper is all about. So I thought about, we sort of thought about that, maybe that's something we could do with access to interpretation and knowledge mobilization. And with these efforts is, have a quick digestible video for people to watch and thinking about that. You talked about us thinking big, and I won't get into what we did there and what the team SKUs did there. Thinking big, thinking smart too, I think I wrote down. So also because, because in our case, we have this dual mandate now with the work we're doing to support internationally educated healthcare practitioners, and we have a KMB plan there. Can we think smart in terms of meetings that we have with key stakeholders on that work, and fold in the work to continue to bring access to interpretation to that discussion to the forefront. So I think that's all I had, and I echo with what you're saying, that sort of thinking about what's the definition of success, and when can you say, this has been a successful knowledge mobilization effort, and thinking about, in a time of system change happening in healthcare, how is it that we can look at in this case, the position paper that we used for the case study today, and say this position paper, we were said, is it a crumb in the big cookie? Is it a giant bite of the big cookie when there was change? And how do you sort of measure success and wins from a KMB perspective that is so relationship driven? So, yeah, Kat, do you have anything else you wanted to add?
No, I think you summed it up perfectly. Thank you.
Pleasure. Thanks, Nikki, for facilitating.
This is making me think about, in terms of the comment about the wish list of who you want to partner with rather than quick wins, and thinking about relationships as being durational and taking time and effort to build, and wanting to really show up for those partnerships, right? Like, how do you support each other as you collaborate on these projects, but also as you work on your own separate ones as well too? I'm thinking a lot about I've heard it from Adrienne Marie Brown. I don't know if she's the originator of the quote or not, but like moving at the speed of trust as in terms of collaborating together, right? Like, just how can you partner now potentially, and how, like, what possibilities might also exist in future? Those might not be things that you know yet or can see yet because your relationship is new, but like wanting to sort of try to trust the process of working together and trust the process of building a relationship together over the long term, right? Like, I feel like those are some of the richest kind of community partnerships I've been a part of, right? Have been those long-term ones. So yeah, that possibilities for what you can partner on in future, and projects that you might want to take on together might look different than they look now, but it's worth showing up for. So.
Thank you so much, Sarah. That was fantastic, and obviously some comments in the chat about a fantastic quote, and that little summary is it's a great way to pull everything together. Thank you so much, Nikki and Michelle, and the members of Group 3 for sharing your comments, and I will now hand it back to Sarah to do our summary and any take-home messages for our group.
What if I could add? Okay, perfect. Why did my slide disappear? Okay, thanks so much for joining us in some brainstorming on mobilizing knowledge today. Really appreciated being able to sort of zip into each of the 3 conversations and hear where folks were at. We hope we left you with some helpful questions today and ways to orient towards doing KMB work. And you can access our knowledge mobilization kit on our resource hub on our website. Andrew's going to put the link in the chat to us or for you guys for that. You can download the knowledge mobilization toolkit in English and French, and search for and download other free resources like reports and fact sheets, webinar recordings, toolkits, and infographics, which you're free to use to support your work. And also, you can connect with us on any of the following platforms. We're happy to continue the discussion with you. If you've had further follow-up questions for us, please be in touch. And thanks again for joining us today. We really appreciate it.
Wonderful. Thank you so much, Sarah. And I will just pop up one last slide.
Oh, and I
our
have one
group.
last, I
Yes,
realized that I
please. We
have
have
a
time.
lightning bolt from Nikki reminding me, we have a poll. I know we had some conversation today as well about there's some poll fatigue just generally in the sector, but we would really appreciate your responses to this. Just to the Knowledge Institute is interested in developing some more resources, and we'd love your input on what would be most meaningful for you. And thanks so much for taking the time to do this as well at the end. We appreciate it.
Those of us who are facilitators can't answer the poll, Sarah, just so you know.
Okay, well,
we will provide we'll
have to
provide
follow up
some
with you
thoughts after. Yeah, send us an email. I'd love
Perfect.
to chat further.
Okay, great. Let's see. I feel like maybe there's a couple other people waiting to respond.
There'll also be additional questions in the follow-up survey from the webinar to give some space for your thoughts on what these tools or resources that would help you in your work could look like, and other thoughts around what could help facilitate your KMB work, regardless of your role or organization. So check that out for sure, and or feel free to reach out to us individually.
Thanks. And I think that's it from us. Colleen, are there any final wrap-up comments that you'd like to make?
Absolutely. Thank you so much. And I'll just pop up my last slide to sign off with everyone. So just bear with me for a moment while I pop that up on the screen so I can share some further details on some upcoming N4 events. And obviously, to start, a big thank you to Sarah, Amy, Nikki, our N4 team facilitators for taking time to participate in today's event. It was fantastic to have this knowledge mobilization workshop and looking forward to future collaborations. Obviously, many thanks to our audience for joining us today, and we hope to see you at upcoming events, 2 of which are listed on our screen currently. Today's presentation will be posted on the N4 platform to ensure discussion continues. And if you have any questions, please feel free to bring those forward, and we'll make sure that our presenters get those. There are also many resources on the N4 website. So if you haven't already, I highly recommend please become a member of N4, all kinds of tools and resources. Following today's session, you'll be invited to complete a brief survey. These surveys really do help N4 and our partners. So we kindly ask that you could take time and complete the survey. And thanks again to everyone for joining us. And I'll pass it back to Sarah in case she has any last words of wisdom. Thank you.
I'm just really grateful for everyone's participation today. Thanks so much.
Thank you.
Have a good afternoon, everyone.